What if I started crying? Would my heart stop breaking? What if I caught the rays of a shy sunrise after a night of consuming darkness? Coronavirus pandemic really had me, going through the motions.
I faced a lot of challenges. One of them was being alone.
Like stuck, and I swear there were moments I started doubting why I even decided to be a writer. I'm like, okay, what am I even doing?
Policy Uganda is a civic tech organization, and our mandate is to redesign service delivery. We function at the intersection of data, design, and technology. As an organization policy, most of our interventions involve using art, so we work closely with creatives. We are working on a project called Data Artistry for Mental Health. In this project, we are using data and art to empower creatives, learn about their mental health. During COVID, we noticed that the small community of creatives that we were working with over time were struggling. As you know, the creative sector in Uganda isn't well streamlined, and most creatives, I think the biggest percentage of creatives don't have stable income.
1 in 5 people has a mental health challenge. It can be anxiety, it can be stress, it could be depression, it could be loneliness, it could be grief. During the COVID-19 pandemic, most of the creatives tended to have sleepless nights. Some of them drew away from their own friends. Others were grieving for their lost friends during the pandemic, the friends that had committed suicide. In this project, we were able to train them and also create more awareness on mental health. For example, we were able to differentiate for them the difference between stress and depression.
I feel like this is a good space for especially the creative artists, because mental health affects someone's creativity.
It's my first time to have a mental health meeting with people. Basically, it has really lifted a whole load on me, because there are lots of things that we, the creatives, really feel about ourselves. It has really opened me up to feel better about myself and also the people around me, encourage them, improve their lifestyle, because confidence and self-esteem are part of it. I really want to come back for this, because it just made me realize very many things around me as a creative.
And these had tremendous effects on their lives. However, there are mechanisms that creative artists shared that they used during this lockdown to be able to go through the mental health challenges that they encountered, which included talking to friends in the same category.
I called friends 24 hours a day and I was not working until I decided to ride and go and see my friends, where I stayed for the last month of COVID.
Others also resorted to other mechanisms of coping up with the challenges that included increased levels of smoking. Very few of them sought help or went to mental health experts in the health sector for support. This was largely because most of the health facilities at that time were focusing on COVID patients.
For a country like Uganda, where we have less than 100 psychiatrists in the country, serving a population of over 42 million people, you can only imagine how the mental health sector looks like.
The districts which were in our study, that is Kampala and Jinja, the mental health experts are mostly not available, meaning even if the patients went there or the creatives in this context went there, they would not easily find the services available.
What this project is doing is we are empowering creatives to learn about mental health, but most importantly, we are supporting them to put in place social support systems that are going to help them handle mental health issues. So we are working with communities like Vodo Art Society.
My name is Wamala. I'm an artist from Vodo Art Society. We work with policy to talk about mental health amongst creatives. The project in Jinja, to me, it has been an experience, a learning process. I have gotten to interact with people of different understanding, people who are seeing things in different perspectives. I appreciate the fact that we have actually learned to collaborate with other people and execute work in the given time. As far as the murals go, we think we have planted a seed. Mental health as an issue amongst creatives and the people around the creatives has been addressed. The messages are out there and they have put an impact, and I feel like we have achieved what we wanted.
The project I was doing was about mental health with a simple theme called Reflections. My sketch was of a woman looking in the mirror of her own self, but in that mirror, it gives her hope of tomorrow. It doesn't have to be always looking outside, but it's better you always look in the mirror to see how it can be helpful in your life.
My mural was comic mural that was talking about some child who was a creative and was the other side of the mother was perfect and to the dad's side was discouraging, and the child shows fear. Then to the other side, the child is relieved mentally by the mother.
As much as the entire world was affected, creatives were also affected, but no attention was paid to them. Creatives on this project learned that actually even just being open-minded and actually paying attention and listening to someone else's challenge is a way of supporting them. We also taught them that creating support groups is one way to actually prevent mental health challenges.
We are going to make sure we instill in these communities mental health champions that are going to be able to handle mental health challenges as they come in, but also create a referral system around them that can support them in a case that a community gets to have someone who has a serious mental health issue. They should be in position to, first of all, provide first aid support, but also moving forward to be able to do a referral at a cheaper cost or reduced cost. So what we have done, we've worked with several mental health experts that have helped us put in place structures that can support creatives respond to mental health.
As much as we are all going through a different situation, one creative is suffering from anxiety, the other one is suffering from depression, but they have overcome different challenges, and during these times, they can always exchange their knowledge.
Creatives suggested some of the measures that could be taken up. Some of them included doing more than just creating, that they could come up with different activities, selling like clothes and other materials, generally doing small-scale trade that could sustain their lives, because one of the things that led to mental health challenges was financial constraints. Using creative arts to help restore but also create awareness on mental health among creatives. And these included paintings in terms of mural that speak on mental health issues, music, dance, poems. These were thought to have a very healing effect on creatives, even other people in the community that could be experiencing mental health issues.
We've been able to partner with some very, very talented artists who have produced some amazing work that will speak to the message. Anyone who sees the work will be able to know what exactly we're trying to put across. Being that mental health is a challenge, and in order to overcome it, we need to work with each other as a community, help one another.
The mural I worked on, we sat as a team, thought of the idea, and we really thought that would work with the community. It's all about someone who is walking away from his past, from his worries, his fear, and focusing ahead to something else. It's on Ginger Main Street, where everybody passes. I really feel that whoever will pass there will really get caught with the message that is there.
We also realized that as the community, we have judged them, we have put them aside simply because we, the society, have a different term for them. And so I would want each one of us who's out there to remember that creatives are part of us. They're in this community because we love their art. So when we see them fall down and crumble, it should not be our time to laugh, but it should be our time to pay back and help them, support them, and lift them up. And acceptance is a key factor in actually healing your heart, your mental health, and your well-being at large. So while you are out there and thinking you are a creative, your mental health is a key factor to your productivity. So take care of your mental health. Remember, our differences make us beautiful pieces. And so your mental health is your priority, my priority, and your neighbor's priority.
We believe as creatives that use their minds to create, I think it's important that they have their mental health in check.
The rays of a sharp sunrise after a night of consuming darkness. Maybe today the puffs of smoke will cease and I will breathe. Do you see the courage in my eyes to keep trying? I think today there is a hope in my soul that everything will be okay. I can feel a creation blossoming above my inhibition.
Darkness, found my way through the darkness. Let your light shine, let your light shine, let your light shine through the darkness. They saying you a queen or a diva. Telling you the truth, you a goddess. They're saying you a king or a leader, but you know they scared of your greatness.
How could they say there's really something wrong when all I ever see is you doing?